Healthcare providers, I have a challenge for you. And I have a challenge for any of the rest of you, even if you aren't healthcare providers, that don't like that feeling where you feel like you stuck your foot in your mouth and you're worried you offended and upset somebody and you feel like you said something that doesn't really represent your values or who you are. If that is you, listen ahead because I have a challenge for you. But before I present that challenge, I just want to say and point out as healthcare providers, I have seen through the decades, we have made great progress in understanding where sometimes we make assumptions and those assumptions affect our relationship with the patients. Those assumptions don't feel really good to us as providers. And here's what I mean, because I want us to celebrate the changes we have made. Back in the 90s, yes, the 1990s, as my kids like to say, you mean you mean in the 1900s when you were born, mom? Yes. Anyway, back in the 1990s, I remember there was the beginning of the awareness to stop assuming that people were married. And this was especially significant in the obstetrics and gynecology world, that just because someone was pregnant did not mean they were married, not assuming every patient of a certain age is married. And so that came to be because somebody might ask about a patient's husband. And then there's the awkward moment, or at least it may or may not be awkward for the patient. I don't know, but often awkward for us as a healthcare provider when we're corrected because now we're worried that have we offended the patient? Have we damaged the relationship? Are they upset with us? Do they think we have some sort of judgment towards them because of the assumption that we made with our wording? And so it became common practice to either ask somebody what their status was, if they were married or not, or in a relationship or not, or all the different language, or to use the term partners. And so we saw the change that practitioners stopped making the assumption of people being married or not. And then there became the awareness that we can't assume the gender of a person's partner. And that began to change. That instead of if you're talking to someone who identifies as a woman, instead of assuming, like once was very commonplace, to assume that somebody who identifies as a woman, that their partner is going to be a man, asking about their boyfriend or their husband or whomever, we began to realize due to those uncomfortable moments where we spoke up and said the wrong thing and got corrected, where we felt badly that upset, that they think we have judgment, so we have all these feelings about it, that we began to become aware and start to practice and use different language and look at our paperwork and see how we can talk and ask those questions without assuming the gender of our patient's partner. Now, I will say, as healthcare, because I work a lot on the patient side, I don't think we're perfect at that, but I think we have gotten a lot better in the last 30 years. So now we use terms like partner and spouse, and it allows us to avoid those moments of uncomfortable assumptions, uncomfortable moments where we've made an assumption with our language. And now I'm going to challenge you to change a little bit more of your language to have that better relationship like we have with the other assumptions we have changed, to open up for the patient to be themselves, to share who they are without them thinking that we have an expectation, whether we do or we don't, but that thinking that with the language that we choose to use. And so here's my challenge for you. My challenge for you is to stop using binary language, to start trying to use more gender neutral language. This is especially a challenge for those in the obstetrics and gynecology world to stop using gendered language and try to use more neutral language. So, this is what I mean. Instead of saying like boys and girls, men and women, moms and dads, that's very binary language. It's not all inclusive. We start using language like children, parents, adults, friends, colleagues, things of that nature. And so, what it means, just like when we've had to change our language in any other time, it means starting to become aware when we use that language, when we start to say ladies or any sort of gendered language. Notice where it is. Is there an option when we're talking in general, in particular, and not about a specific person? Is there an opportunity to use a more inclusive term, like patients, rather than the women in my practice, the patients in my practice? Think of those examples. So it begins with noticing, where are we using gendered language? Where are we using binary language? And then it comes to, like, what word could I use instead? What is the language I would prefer to use that would be inclusive with the same intention of who I'm talking to or talking about? And I have a bonus practice for you. Here is a bonus practice with HIPAA compliant points. When you are talking about a patient, not to a patient, but about a patient, especially with a colleague, a consult, something along those lines, I encourage you to practice using the singular they. Now, if I'm talking to a patient and I know their pronouns, I'm going to use their pronouns, whatever they are. Practice using the singular they, and here's why. One, we're not accustomed to using the singular they for a specific person, so it is good practice to use it. The second thing, and this is what I mean by HIPAA compliant, it helps to de identify your patients when you are talking. And even though we try to be very discreet, I can tell you many times healthcare providers are often speaking in an area where they may not always realize other people can hear. So it is a great way to de identify a patient if, when we are talking about patients with other providers, we start using the singular they to help de identify and help ourselves practice using the singular they. Now, that's just a lot of extra credit on the challenge I already gave you of beginning to notice where your gender language is and where you can be more inclusive. But I know us healthcare providers, we are overachievers. We want that extra credit. So there's the extra credit. Start using the singular they when talking about patients with other providers to practice and provide privacy, both. So I'd love to hear how it goes. Please share with me your thoughts, how it goes. And if you need help finding what word could I use instead of this word, reach out to me. We'll talk. Have a great week.